All right, well, welcome everyone, and thanks for joining us. My name is Brian Anderson. I am the Chief Digital Health Physician for the MITRE Corporation. Today, I'm joined and have the pleasure of being joined by Mr. Rick Klau, who is the Chief Technology Innovation Officer for the state of California, and Dr. Chris Longhurst, who is the Chief Information Officer for University of California, San Diego Health. Today, we're going to be talking a little bit about some of the amazing work going on in California with smart health cards and proof of vaccination. And so right now, I'll pass it off to Rick and to Dr. Longhurst to share a little bit more about themselves and the effort. Rick, over to you.
Thanks so much, Brian. As mentioned, I'm the Chief Technology Innovation Officer at the state of California. It's a new position for me. I joined the state about 7-8 months ago. After a long career at Google, I had been a private sector guy up until this point. And initially brought into the state really entirely focused on the state's COVID vaccination response. Early on, it became pretty obvious that as we were going to work to reopen the state, we were going to need some way to allow businesses to verify the vaccination status of people who wanted to enter those bars, restaurants, businesses. And wanted something a little bit more secure, a little bit more portable, harder to lose than a piece of paper. And that was the motivation behind what eventually became the digital vaccine record that we'll talk more about shortly.
Great. Dr. Longhurst?
Dr. Anderson, thanks for having me on today. As you mentioned, I serve as the Chief Information Officer and the Associate Chief Medical Officer for UC San Diego Health. And in early January, in partnership with the Padres, the City of San Diego, and the County of San Diego, we opened the first vaccine superstation in the state of California. By the end of March, we'd vaccinated over 250,000 San Diego residents. And of course, as Rick mentioned, we were giving them each yellow cards, but we knew that many of those would get lost. And we began to explore ways that we could also provide digital copies of their vaccine records for later verification purposes. So we're really excited to be here today to join you in this conversation, talk about what's possible, not only in California, but across the country.
Great. Well, so to set the stage just a little bit, so the Vaccination Credential Initiative started back in January of this year when we formally launched publicly an effort that was principally driven by private stakeholders. So companies like Microsoft and Mayo and others believed that there was a need to have a digital certificate that was verifiable and trustworthy that could prove as documentation that one got a vaccination for the COVID-19 virus. It rapidly grew in terms of adoption and engagement from other organizations within the private sector. The effort began focusing really on helping those that had records of administered vaccines to be able to issue these certificates, understanding the open source, freely available standard and the technology infrastructure that would be needed to be able to issue these kinds of credentials. And so, Chris, I'd like to really look to you and maybe if you could explain to us, how did UCSD see this as something that they wanted to lean into and get engaged in from your perspective as CIO of UCSD Health?
Yeah, thanks, Brian. And I want to mention both Dr. Anderson and I are pediatricians, and so vaccination is really near and dear to our heart. In fact, working with Rick and the state on the immunization registry was something that we had been doing for a while prior to the COVID vaccination. But as I mentioned, as we started the superstation effort and began vaccinating, not hundreds of patients, but tens of thousands and hundreds of thousands, we really wanted the opportunity to help share a digital copy of those vaccine records for later verification as well. And so I think it was in February or March when UC San Diego Health joined VCI as a member and later as a steering committee member. And we really wanted to endorse a standard like smart health cards that could be adopted not just across the state, but across the country as well. And of course, we're beginning to see that. But in partnership with our electronic health record vendor, Epic, we were able to begin issuing these smart health cards by the end of June. And we've seen really tremendous adoption among our patients and consumers in the San Diego area.
Fantastic. And so, Rick, I know that this was something that you have been looking at in the state of California and been discussing with a variety of your team about how California could lean into this. How did you come about making the decision to adopt smart health cards and setting up your portal?
Well, in hindsight, I wish that we had been a little more coordinated. Although I'm thrilled that we all ended up in the same place. It started at the state level with some exploration that I and some colleagues at the Department of Public Health in California were doing in March, and it was really in anticipation of the state reopening in June. And we chatted with some folks at the federal level. We got to a sense of what some of the options might be were we to present some digital copy of the vaccination record. And pretty quickly ascertained that smart health cards gave us a number of what felt fairly critical wins. First and foremost, it was open. So it wasn't going to require us to execute a vendor contract. Wasn't going to require any particular implementation on the part of those who wanted to verify those vaccination records. So it would be zero cost, it would be lightweight, and it would be very easy for other states to do the same thing. It was really a guiding principle for us that we didn't want to do something that was unique to California. We wanted to do something that would be hopefully become a standard, if not just in the United States, but also potentially worldwide. So the fact that it was open, the fact that it was free, the fact that it was standards-based, it allowed my development team to very quickly build a proof of concept, meant that we had all the components if we chose to proceed as a state, which of course was not a technology decision, it was much more a policy and communications decision from the governor's office. Then it became something that it supported each of our goals and avoided us locking ourselves or our small businesses into any one particular approach.
So it sounds great, Rick. How difficult was it to stand all this up and implement it? Did you need an army of developers to do this, or how straightforward was it?
This is perhaps the thing I'm proudest of. From the first line of code that folks on my team wrote to the millionth digital vaccine record delivered to California residents was under 2 months. We started development in earnest on this project in the first week of May. We had a proof of concept up and running a week later. We had our first iteration of this talking directly to the California Immunization Registry a week after that. By the fourth week, we essentially had a fully completed system. At that point, the last couple of weeks prior to launch, we're really focused on translating into 8 languages, building up the FAQ content, getting everyone aligned on messaging, communications. And then in that 6th week, shipping, we launched on June 18th. So as of this recording, about 6-7 weeks prior.
That's amazing. And congratulations on that. Can you just very briefly for those of us that aren't familiar, Rick, describe how does the data flow into the registry from health systems, from mass vaccination sites, from pharmacies? How does that work?
Well, this was, as you might imagine, a fairly steep learning curve for someone who comes to this not from the public health or even from the healthcare system, but private sector, working at Google for a number of years. Early in this effort, before we were even talking about vaccination verification, one of the earliest projects I worked on was figuring out how the data was coming from healthcare providers, from clinics like UCSD's Superstation, into the state registry so that we could then report up to the CDC. And very early on, it was obvious that there were a number of different routes by which that data could get transmitted and turnaround time. A dose might go in an arm and it might take days for that dose to get reported to the state. And understanding each step in the process ultimately served us very well when we built out the digital vaccine record, because I think we understood the moving parts quite a bit better. To answer your question, each healthcare provider is required to report when a dose is put in an arm. That dose needs to be reported to the state immunization registry. That happens through an HL7 message that is delivered to, in the California case, an Oracle database that is the warehouse for all of those HL7 messages. Those messages are then transformed through a series of business logic, some transformation routines, into what we think of as the California Immunization Registry, or CARE. And that is the source of truth for all of the vaccination records in the state of California. Importantly, for our purposes, each of those vaccination records had the ability to include, and often did, contact information for the vaccinated patient. So in addition to getting first and last name, date of birth for the vaccinated individual, we were also given, in most cases, a cell phone or an email address, or sometimes both. And of course, the immunization registry predates COVID, so there was already a number of records in the immunization registry, millions of records, that already had contact information associated with those folks.
Got it. Thanks for sharing that, Rick. And so, Chris, all of this is going on at the state level. What's the role of UCSD Health, and how did you lean into and help in this area?
Sure. I want to reiterate a couple important things that Rick said. First of all, one of the reasons that we chose smart health cards is because they were open, non-proprietary, and privacy preserving. And in fact, Rick also mentioned that we're building on an infrastructure that had been created over the course of many years, and in some cases decades, whether that's the California Immunization Registry and the fact that all of our health systems are already integrated and reporting to it, or the Smart Health Card standard itself. And I want to give a hat tip to Boston Children's Hospital, including Dr. Ken Mandel, which helped to create the SMART standard. And so for us, it was a fairly straightforward decision in February or March that this was the right standard for us to adopt. And we began to partner with our electronic health record vendor, Epic, who also adopted that standard. And the reason that this was important is because we want to see this adopted, again, not just in San Diego or the state of California, but across the country, and as Rick suggested, potentially across the world. And so we wanted to be a leader to help set the pace for that. And that meant being an early adopter. And so we were beta partner in developing this code with our vendor partner. And we were able to test it early on. For example, we are a trusted testing partner for the state of Hawaii, and we were doing a lot of PCR testing for people who wanted to travel to the state. So this Smart Health Card standard for digitally verifying clinical information works not just for vaccines, but also for PCR test results. And we were able to verify and confirm that, such that when we went live in late June, subsequently the state of Hawaii now is accepting these QR codes for testing in those who aren't vaccinated but want to travel to Hawaii.
That's great. And so can you share a little bit about, what are you seeing outside of Hawaii? Are there other areas where smart health cards are being adopted as destinations that are looking to use them for proof of vaccination? Sure.
It's a really exciting time right now. Just recently, we saw the Grand Caymans announce that they're accepting smart health cards. And in fact, Aruba previously announced that that was the only way that they would do vaccine verification for travel to the island. We expect more of these announcements soon. And here in the state of California, a couple of weeks ago, we've seen bars and restaurant associations also begin doing vaccine verification in San Francisco Bay Area, Los Angeles, and elsewhere. And we know that many of these bars and restaurants are digitally verifying using the state and health system issued QR codes.
And so, Rick, Chris brought up bars and restaurants. I feel like it's, ripped from the headlines, just in the past 2 or 3 days with what's happening in San Francisco. Maybe can you share a little bit about what you are seeing on the ground and what you're hearing from the citizenry of California, and where you see this might be going with how these bars and restaurants can verify these issued smart health cards?
Yeah, in fact, it is almost, I would consider, close to textbook. When we were talking in April, May, when we were having conversations around the state about if we were to do this, what would need to happen for it to be successful? Because, of course, it's one thing for the state or UCSD to issue a smart health card, but that's just one part of the ecosystem. Because it's not required, because it's not mandatory, there really needs to be a coalition of the willing, not just of residents of the state of California who want these digital vaccine records, but then the businesses who have an interest in keeping their staff safe, keeping their businesses open. And it really is a ripped from the headlines case study, because as we were prepping for this discussion, two big announcements came out while we were chatting. One was the San Francisco Bar Owner Alliance that represents 500 bars in the city of San Francisco. Later that day, I chatted with the executive director for that alliance to better understand both what they were trying to do and then make sure that they had all the information about what they could do with the Smart Health Card. They were fast followed by the Golden Gate Restaurant Association in the city of San Francisco, representing hundreds of restaurants. I believe we will see more announcements in the days ahead representing small businesses throughout the city. That, of course, is now spreading throughout the Bay Area, and we've also seen examples in LA and San Diego as well. What's starting to happen, and I'm seeing the reality on the data side of analytics for the digital vaccine record and seeing the pace at which people are requesting and receiving records, is that as restaurants, bars, businesses communicate to their patrons that this is something we want to do for our benefit and for yours, the interest in residents getting a vaccine record is going up, which means that at this point we have now delivered more than 1.7 million digital vaccine records. That pace is actually picking up over the last few weeks. And the more people who have them, the more there is a supply of these records that businesses can depend on and get used to verifying and asking for and feeling like it's a fairly normal part of whatever passes for normal these days with regards to Delta and what might follow. So it's been just thrilling to see the state as a participant in, but not really a director of this groundswell that is giving residents and businesses an opportunity to figure out where they want to draw that line and how they want to partner to try and keep life moving forward.
Yeah. And Rick, so what are you hearing when you talk to the folks in San Francisco or elsewhere in terms of how they are verifying these smart health cards? Is it just looking at the digital certificate? Is it more than that? What are you hearing?
I think my favorite was a bar in San Jose that was chatting with me on Twitter over the weekend when they posted on both Twitter and Instagram a notice to their patrons that they would be verifying vaccine records at the door and pointed to the state's vaccine record portal as a way to retrieve their QR code. And I asked, well, are you scanning the QR code at the door? And they said, well, we didn't know we could. But that sounds pretty cool. So I sent them the Commons Project Trusted Verifier app. They got back to me later that day with holy cow, this is amazing, this free tool that we can now equip folks at the door with an ability to scan that QR code. It sped the process up. And that anecdote I was sharing with both the Bar Owner Alliance and with the Restaurant Association. So I think now that there is a growing awareness that these tools exist, and I'll echo comments Chris made earlier. Having this be an open standard meant that we didn't need to build all the pieces of this puzzle for this to develop organically. So by us committing to the creation of a digital vaccine record that followed open standards, it meant that when the Commons Project folks showed up with a Trusted Verifier app, we didn't need to work with them. They didn't need to work with us. We'd followed the spec just like Chris and the folks at Epic did, and they can show up and equip bar owners and restaurants with a device they can install on an iPhone or an Android device, and it just works.
That's really cool. That's a great story. So Chris, you're obviously a leader in this space, helping to lead not only from UCSD Health, but UC Health and from your steering committee leadership role within VCI. Where do you see all this going? So it's COVID vaccines now. Where does this go from here, Chris?
Yeah, great question. Well, first of all, it's really important that there's a role in the health systems here as primary source verifiers to also issue these cards. Rick has done a great job with the state of California, and he alluded to the fact that there's sometimes data challenges when you get data from disparate sources, merging them and things like that. And so we think it's really important that health systems across our state and country are also issuing these. And we found from our patients that they consider this a service as well. So I would like to see, first of all, more health systems adopting this across the state and country. And because we've worked with our vendor partners to make this easy, it's really a matter of just flipping on the switch and configuring your software to turn it on. Of course, there were some in our health system that were concerned about potential concerns that might come up from the community. But I would say that the fact that the state had done this prior to us turning it on really helped to mitigate that. And in fact, the response again from our community across the political spectrum was, hey, this is a service that helps me travel more easily. Thank you for doing it. The second thing I think, Brian, is that it's really important to understand the Smart Health Card standard is not for encoding COVID vaccines, right? It's for digitally verifying clinical information. And so we can encode more information in these encrypted QR codes than we are today. And in fact, as a pediatrician, one of the things I'm really excited about is the opportunity to share an entire digital vaccine record that you could take with you throughout your life. So imagine being able to verify yellow fever or dengue vaccines for travel to Africa, or potentially all of your childhood immunizations for registration at a university. These are kind of things as we move forward, I think that we'll see more of, because COVID has accelerated the adoption of this standard, but the standard can really support a lot more than we're doing with it today.
That's great. And so, Rick, you're obviously a leader at the state level and certainly at the forefront of states issuing these credentials and leaning into this space. I'm curious, from your perspective as a state leader, where do you see smart health cards going for you?
Well, I think there's two important things, and one is perhaps not obvious, but I would love to make sure that folks in this audience hear it because it was an unanticipated but incredibly welcome benefit of having shipped the digital vaccine record. Chris just alluded to the fact that the data quality in the immunization registry was uneven. We knew that at launch. There was really nothing we could do with it. We are a recipient of data delivered to us. In many cases, we don't have any independent way of verifying that data. We take what we are given and then add that to the system, and it is as good as the data as it was delivered. Prior to the launch of this, there had been no resident-facing mechanism that would give people an ability to see what was in the state registry. In fact, many people didn't even realize that when they got a flu vaccine, when they got a COVID vaccine, that went anywhere or there was any system that was tracking that information. But the moment we launched, it gave everyone an ability to see, what does the state know about my COVID vaccine? And in some cases, there were doses that hadn't been registered. In other cases, people couldn't retrieve their record because they didn't have a cell phone in the immunization registry. And for the first time, we had a complete alignment of interests because providers wanted their patients to be able to get these records, patients wanted to get these records, and the state wanted to deliver these records. And the easiest way for that to happen was for the data to improve. So we found that once everyone understood how that worked, pharmacies, health systems were very eager to get us whatever we needed to improve the coverage, the match rate of these requests for vaccine records. In just the first month and a half, we've taken updates to over 15% of the immunization registry. That represents millions of records updated. That's a pace that had never previously happened. And it was all because there was suddenly a spotlight on the data quality or lack thereof. So and this gets to the part of your question, where do we see this heading? The better the data quality, the higher our confidence in our ability to deliver more than just a COVID vaccine record. What we built was a mechanism to deliver that information back to the individual to empower them, to give them not only access to their own information, but the ability to decide what to do with it, where to store it, where to present it, share it if they choose to, which really at the end of the day becomes a question of empowerment. Have we given them access to their own information to make it more usable, to make it more portable, so that they can then get back to doing what they want to do, go to the businesses, the bars, the restaurants that they want to, and also empower those same businesses to make a decision for themselves about what they want from the patrons coming through their doors. The system that we built by embracing the Smart Health Cards standard meant that we weren't just solving for the residents of California. We were committing to a system that could be easily extended to any other state in the country who chooses to do the same thing. That makes it far more valuable, far more functional, which when all is said and done, when we're on the other side of COVID, I think we'll all look back and feel very good about having committed to something that was easy for everyone to participate in and commit to, and ultimately benefit from.
That's great. And I think that's exactly right. Rick, thank you for sharing that. Well, Rick and Chris, thanks so much for joining us here. This has really been educational for me. Chris, any other final words you'd like to offer before we sign off?
Thank you so much for having me today. I hope everybody enjoys the rest of the conference.
Wonderful. Rick, any other final thoughts?
I would love to hear from any of you who are interested in doing what we've done in California. Really grateful for the opportunity to share the story. Thanks.
Well, great. Well, fantastic. And thanks for joining us, everyone. There will be some additional members from the Vaccination Credential Initiative on site there at the national conference. So if you have any questions, please feel free to reach out to them. And I hope you have a great rest of the conference. Thanks for joining us.